My assessment project focused in on the 2010 outcomes of the National League for Nursing. And the National League for Nursing is one of the major organizations for nursing. They identified 4 new competencies: human flourishing, nursing judgment, professional identity, and spirit of inquiry. These replaced the 7 previous ones that were used in our program. And in order to maintain the standards of our profession by our accrediting body, which is the Accreditation Commission for Education in Nursing, we need to be sure that we include these competencies and that our students and graduates are achieving these competencies. So part of my project is that I developed a template, and the template included a description of the NLN competencies. I correlated that with the student learning outcomes that we have existing in our nursing program, and talked with the lead faculty to identify exemplars as to how they would measure competencies and how the students have achieved these competencies. So the faculty that were assigned to theory courses used a variety of different exemplars. They used tests, quizzes, case studies, concept maps, and then for our clinical courses, we used our clinical evaluation tool, which is a very detailed tool that analyzes our student learning outcomes. There was 100% compliance from the nursing faculty. They returned 11 templates for the theory courses and 8 for the clinical courses. I in turn analyzed the results based on their information. I also used a weighted analysis to identify students depending on the number of students that were enrolled in the course. So the outcome of the project revealed that we are maintaining and meeting our competencies. We're slightly short in 2 areas, and the 2 areas are professionalism, and that correlates with the NLN competency of professional identity. There was about 79% achievement. And the second one was related to spirit of inquiry, which was related to our student learning outcome of lifelong learning. And there was an achievement of about 75%, and our expected outcome was 80%. So what I did do is take all my data and my summary of my report and presented it to the faculty at our August 2012 faculty meeting, and share the information with them. And so from that meeting, the courses that were identified as not achieving quite a 80% did develop a plan for improvement. So we continue to use a template. We find it very valuable to identify and make sure that we're maintaining quality and integrity of our nursing program.